Now, the fate of 9,000 members of staff employed under the universal health care in counties hangs in the balance after the Council of Governors claimed they have no funds to sustain the employees whose contracts expire in May 2023. As such, the Council of Governors is calling for increased allocation of funds to the county, as well as have the UHC employees managed by the counties and not the Ministry of Health.
So where is the chair?
The Council of Governors now says there is a likelihood of disruption in health services if 9,000 employees deployed to counties under the Universal Healthcare Program lose their job owing to a cash crunch experienced by counties. To avert the risk, CoG is calling upon the government to increase resource allocation to counties to help manage UHC employees whose contracts expire in May 2023.
The contracts for more than 9,000 staff recruited under UHC program is coming to an end in May 2023. There is a potential disruption of health services if the staff leave hospitals due to lack of resources to sustain them. In this regard, the Council of Governors will engage the Ministry of Health to agree on a roadmap for implementation of the Universal Health Coverage UHC program. Further, we urge the national government to provide additional budgetary resources to county governments for renewal of contracts of UHC staff at the market rate salaries. The payroll management for the UHC staff should also be transferred to county government.
At the same time, the governors have faulted the establishment of authorities by the Ministry of Health to manage devolved functions without the input of counties, thereby interfering with their mandate.
National Syndemic Disease Control Authority and the Kenya Tissue and Transplant Authority. The council moved to court challenging the establishment of these authorities on the basis that 1. They were established with gazette notices without consultation or involvement of county governments. 2. The authorities have been created to undertake functions that have been devolved to the county governments. And 3. County governments are not adequately represented in the board of management of these institutions. Further, this continues to be a trend whereby the national government creates institutions to undertake devolved functions. Our take is that this is a calculated move to ensure that the equitable share by the national government continues to increase at the detriment of county governments.
The governors also want the ministry to halt the procurement and installation of medical equipment, claiming counties are better placed to determine what machines are needed.
Our position, therefore, is that Ministry of Health should stop interfering in devolved health service delivery to return order in the management of health services to the counties.
The annual devolution conference is set to be held in Uasin Gishu County under the theme 10 years of devolution, the present and the future.